It's time for another new Kansas City Spotlight. Here's your host, Belinda Post.
If you're one of the millions of people living with depression, daily life can be a struggle. For some, medication isn't an option or it isn't enough. Could TMS therapy be the future of mental health treatment? Let's take a closer look at Sunrise Psychiatry with Dr. Sunny Elliott. Let's walk back. Remind us what TMS therapy is and what it stands for.
Great, I'm glad to be back. So TMS stands for transcranial magnetic stimulation, and it's an FDA-approved treatment that's been out since 2008 that is for major depressive disorder and various forms of anxiety.
So when you take a look at the brain using a functional MRI, walk us through the process.
So with TMS, we invite people to come and talk with them about the ways that TMS is helpful, which the TMS machine is a very low-level magnet that sends pulses to areas of your brain that are affected by depression. And by getting those treatments over and over and over, it basically helps to kind of stabilize the circuit through increased oxygenation of the area, increased blood flow of the area. There's actually what we call neuroplasticity of the brain, so you do see some regeneration of brain cells, and that does help to treat depression and anxiety over a number of treatments.
And if someone's listening to this and is interested, who would be a good candidate?
That's a great question. For me, I say that, most people typically are candidates for TMS more than think that are possibly eligible. Those that are not eligible at this point, unfortunately, are people that have any sort of tumor that might be in the brain, history of epilepsy, or people that have a history of bipolar I disorder or a history of psychosis. Outside of that, we pretty much say anyone that's 15 years or older, as it's been approved by the FDA, could be eligible for TMS. Because you're not ingesting a pill, it's really well tolerated with very, very few side effects, and the response is greater most cases than medications.
And where can people go for more information?
We encourage everyone to definitely go to our website and give our clinic a call.
All right, well, Dr. Sunny Elliott, thank you so much for your time.
Thanks for being here.
This Kansas City Spotlight has been paid for by Sunrise Psychiatry. For more information, visit sunrisepsych.kc.com.